out of Palisa in 2010, Kibuku is a district at crossroads. A population explosion has forced the district to struggle to extend quality health services to its populace. The national census in 1991 estimated the district population at about 91,200. This rose to 128,200 in 2002. The National Population and Housing Census Report 2014, meanwhile, revealed the population had surged to 202,033. There is a gap in communication, with many mothers accusing medical workers of rudeness, which affects their demand for services.
You find that most mothers go to the facilities when they are not prepared. They ask even simple things like a razor blade when the mother cannot provide. And most of them go to the facility just one person, not escorted by anybody.
Local government leaders are concerned that male involvement during pregnancy, delivery and post-delivery period is minimal, which is impacting maternal and newborn health outcomes in the district.
Some of these gentlemen, they are business people. How do they stay at their homes? And most of the time they think in terms of business. I must do this, I'm going to somewhere. Some of them also, they are workers like I do. At 8, you are required to the place of work, but you have to accompany your wife somewhere and end of the day.
Absenteeism is also another challenge affecting service delivery in the district.
There is a lot of absenteeism. There is a lot of negligence. There is also bad customer language. You find that some of these midwives, the way they handle their clients, the pregnant women, just demoralizes them.
Against this backdrop, one wonders whether the district leadership is doing enough mobilization of the communities, playing their supervisory role, let alone responding to the health system needs to effective service delivery.
What are some of those things? You know that.
Inquiry into how leaders can work with the community and health workers to improve maternal and newborn health is part of the community scorecard study of Makerere University School of Public Health in partnership with the Future Health Systems Research Consortium in exploring Kibuku District. The community scorecard is a two-way and ongoing participatory tool for assessment, planning, monitoring and evaluation of services.
The performance of facilities in terms of delivering services is not as good as it should be, and there isn't enough accountability about services that should be provided and the people responsible. And so the community scorecard is one of those tools that you can be able to use to improve performance of facilities and also to improve accountability by the different stakeholders who are responsible for improving the performance of facilities.
It is an exciting way to increase participation, accountability and transparency between service users, providers and decision makers.
Through this scorecard process, the facility will be able to identify indicators that it can use to measure and assess its performance, and it will score itself to see how it is doing, and then identify the reasons why its performance is not as good as they would want it to be, and also come up with action points to be able to improve their performance. Communities also have a responsibility in relation to maternal and newborn health. For example, households need to plan for delivery.
The first scoring process in November 2017 allowed the community, leaders and health workers to identify key challenges and seek solutions to maternal and newborn health outcomes in the district. With a subsequent interface that allowed stakeholders to point out barriers, leaders now easily find solutions to the challenges.
When they introduced this scorecard, because the health workers had their issues, the community also came out with their issues. it has tried to reduce the gap in the way that nowadays when you are at the facility, you can see some husbands escorting their wives.
Before scorecard, we were getting difficulties with people. We had these traditional birth attendants around. They were there, and you see the disadvantages of delivering from traditional birth attendants. But they were there before scorecard. So it has, I would say it has eased our work as leaders.
What is important is the scoring process has ignited a flame among leaders in the participating communities. Leaders now have the task of ensuring that the achievements so far registered are maintained.
Before we started implementation, we had some interviews with the district to find out what they think about the scorecard, to find out how they think it should be implemented, to find out what things they think we need to do. So in implementing it, we are trying to implement it in a manner that can allow it to be scaled up. That is already factored in. So when we finish again, we hope to sit down together with the district officials and see what we need to change so that it's easier for us to scale it up at district level. But even right now as we implement, we are working with the district, we are working with the local officials, and so we are trying to implement what they think is feasible within their local context, and we are hoping that that can make it easier for this to be scaled up.
The knowledge has sunk in us, and we know how useful it is, and we know where it found us. Though there is that element of saying, where is money, where is money, where is money? But let's look at the thing we are dealing with. For instance, this maternal and health, mother and newborn health. Is it for some particular individuals? When you look at it, it is universal, and it is for us. Then I think, even if Makerere withdraws, the idea will remain, and those people with clear thinking brains, they will continue with the process.
We've made it a cross-cutting issue. In this other program of ours, whenever we go, we talk about scorecard. Whether we've moved out to sensitize people on human rights, on gender issues, whether we are launching a road, whether we are meeting groups, we talk about scorecard to make it, common.
To the leaders, the scorecard process has underscored the need to jointly work with the communities and health workers to improve maternal and newborn health service delivery in the district. Without leadership involvement, community members and health workers may not achieve much.